notes. Here we are. There we go. Sorry about the wait. It is pretty busy today. We're busy every day actually, but you know, we struggle on through. It's very nice to meet you. I hope you're doing well. Obviously not too well, because we want to actually see our patients. Wouldn't be any fun if there was a hospital, no patients. But okay, I'm just looking through your notes here, which I totally should have looked at a few months ago. Never mind. Okay, so you're here for your eye exam. Okay, great. So I'm just going to make a few notes here. If you could just tell me your first and last name, please. Okay, we have a match. And the first line of your address, please. Okay, that's great, thank you. Okay, so we're going to be taking about 20 or so minutes. Get yourself nice and relaxed, take a deep breath. Okay, I won't be asking you to do anything difficult. I will be explaining as we go. Okay, so it'll be nice and easy for you, and hopefully the whole process will be relaxing. Okay, so are you ready to start? Okay, great. So put your gloves on, as we're regulated to do. Now I can change the process, the order of the tests that I will be doing. I like to sort of mix it up a bit, just to make my day a little bit more interesting. So first of all, I think we're going to start with just a simple inspection of the eyes. First of all, using just my hands, and I'll be gently pressing around all different areas of your eyes. And the idea is for you to tell me if there is any discomfort whatsoever. Okay, nice and simple stuff. Okay, so you ready to begin? Alright, so I'm just going to be pressing, get a little bit close here, pressing around the eye, looking for anything that's unusual in colour or consistency, and I want you to tell me if you find any discomfort or pain as I press the various points around the eyes. Okay, how's that so far? Is okay, no pain? Wonderful. Again, just palpating around the eyes. Okay, just between the eyes there. Nothing when I do that, no pain. Okay, that's great. Okay, looking good so far. I'm just going to double check around all around the area of both your eyes once more. Just got to be thorough, make sure we haven't missed anything at all. Okay, so alright, I'm going to be taking a look once more around your eyes using a light this time. It's not a bright light, so don't worry about me blinding you. There you go, I'm not even blinding myself, so just keep it nice and still. You can pick a point on the back wall if you wish, or stare at my wonderful nose. It's entirely up to you, but I will be shining this light just around these areas, and then once I've done that, I'll be actually taking a look directly into the eyes. Okay? Alright, here we go. So first of all, just having a look around the eyes, just looking for anything unusual, particularly with colouring, any inflammation, any reddening all around the eyes. Can be a telltale sign that there's something up. And our bodies are good like that, that it often tells us, even from the most subtle signs, when something is a little bit astray, quite, a little bit not quite in balance. So far everything looks fine. Okay, looking good. Just taking a nice slow look around the eyes. making absolutely double and triple sure there's nothing going on here. We don't want you going away and coming back with an issue, so we are very thorough in our inspection. And I didn't find anything using my hands, and I'm certainly not seeing anything using the light. We'll come over to the side, just taking a look here, and yeah, it looks very good so far. Getting over to the other side here, and again, looks absolutely fine. Okay, just going to take once more a look at the front. It's fine. Alright, we'll take a look in your eyes in just a moment. I will just be jotting down a few notes here, just part of noting down the process as we go along with my findings. Makes it a little more comfortable here. Pencil, there we go. But you're doing very well so far, so well done. We will do a range of different tests very shortly, and I'll be talking through the process as we go along, so there's nothing to be frightened about. It's all very simple, and I'm sure that you will ace every single test that we do. It's unusual to actually find many issues with these often very simple tests for most people. I expect you'll be able to pass with flying colours, so we'll get to that in just a moment. Alright, so now I'm going to be taking a look directly into the eye, first using this very low powered light. I'm then going to switch to my wonderful gadget over here, and that will check with a much brighter light and give me magnification. I can check all around the eye, including the back of the eye as well, so it's pretty nifty stuff. Alright, so very quickly then, a very dim light into both of your eyes. Are you ready? Alright, here we go. So right eye first. Yeah, it's not too bad, is it? It's not too bright. Just take a look, various elements of the eye. I won't get too technical mumbo jumbo, because I know I do bore patients at times. I've learned to sort of try to keep things to a minimum when it comes to terminology. Okay, but yeah, we're looking good so far. Just looking at the way the pupils react to the light, along with looking at the white of the eyes, just to make sure there's nothing out of the ordinary. Okay, and we'll be using the light for a couple of the tests as well in a moment, so I'll talk through those as we go. Okay, so on the left eye now, and everything looks absolutely perfect. You have very nice coloured eyes, I must admit. It's quite unusual to see this sort of pattern. So it's not just the colour we look at, it's also the patterning as well, which seems to be unique for each individual, and I have to say that yours are rather special. Okay, looking good. Alright, I want you to perform some very simple tasks now. So I'll be noting as we go along. So first of all, I just want you to simply close your eyes, okay, and open them. Okay, that's actually that's a pass on one of the tests. It's that simple. So well done. Okay, if you can look to your right. Okay, hold it there. Okay, and look to your left, please, and hold it. Okay, and now I'm going to ask you to look up. Hold it there. And look down for me, please, and hold it there. Alright, that's fine. You can blink away, get yourself nice and relaxed. That's wonderful. so very simple test once more. Follow the finger test. Rather simple. I'm going to mix it up by using both of my hands. I want you to keep your head still as you possibly can, and the idea is that you keep your head still and you're only moving your eyes. Okay, so I want you to look at the top, the very tips of my fingers, on the ones that are actually moving. So do not look at the one that's stationary, but rather the one that's in motion. Okay, think you can manage that? I'm sure you can. Alright, here we go. So once again, looking at the tips of the fingers that are in motion. Good. Okay. Well done. There we go. Pretty tricky, but you are doing very well. Just looking at both of your eyes as we do this exercise, making sure they're both tracking adequately. So far, there we go. You didn't know I was going to do that, did you? We do try to keep our patients on their toes, and you're clearly very intelligent enough to keep up, so well done. Alright, we'll leave it there for now. You did very well. Once you throw in the diagonals, it does get a little bit tricky, but you absolutely smashed it, so well done. Okay, so that's that done. I'm just going to write down 10 out of 10 score for this exercise. No problems tracking. Very good. Okay, so very similar. This time using the light, so quite simply I just want you to follow the light. Okay, it's very dim light. I know it is difficult to track, but we'll try anyway. Here we go. So following the light, not looking at me, not moving your head, simply moving your eyes and tracking the very end of this pen light. We're going to throw in the diagonals. Very good. Alright, well done. Okay, so we're going to be testing your peripheral vision now. So I want you to look at my nose, and I'll be moving my fingers out of your cone of vision, and I want you to tell me while looking at my nose when you can't see my fingers anymore. Okay, so keeping your head still for me, looking directly at my nose, and tell me when you can't see my fingers in your cone of vision. Okay, ready? Okay, here we go. Going up, so again looking at my nose. Okay, and going down. Okay, hold on. So you have, I would say, greater than normal peripheral vision, which is very good indeed. So you can go a lifetime without knowing that, so it's good to know, isn't it? Alright, so that was the field of vision test completed wonderfully. I'm going to point now to my chart, which you've probably no doubt seen a million times before. This is the Snelling Chart, not to be confused with the Smelling Chart. Right, I'm going to be simply pointing at a line, and I want you, to the best of your ability, to tell me what each letter is. If you don't know it, then your best guess is acceptable. Okay, so with both eyes open, you can tell me what this is. This. Okay, we started you out nice and simple there. If you could cover over your left eye from, in whichever means is most comfortable for you. Okay, I want you to tell what this is. Okay, if you can cover up your opposite eye now, and to the best of your ability, if you can tell me what this is. Okay, well done. Now I'm just going to move the chart back a little bit. I can, I'll first of all ask, what colour do you see here? This line here, and this one, please. Okay, and which of the two, if any, are sort of standing out more to you? Which looks bigger, brighter? Okay, that's fantastic. Okay, so that's the Snelling Chart done. Alright, so we're going to be doing another simple test using my hands, and I want you to answer how many fingers I'm actually holding up. Okay, so we're going to count the thumb as well, so that would be 5, this is 1, and also this is 1. Okay, so we're going to be mixing it up a little bit, keeping the old cogs turning upstairs. So here we go, either side of my head, I'm going to be holding up some numbers, and very importantly, do not keep your head still rather, and look, that's my nose. Yes, you knew there was a trick coming, that was it. So keep your head still, looking at my nose, and to the best of your ability, if you can tell me what numbers you see. Okay. Very well done. Okay, for this part I need to take these off. Very simply, again, we're going to be asking you, very simply, I'm going to be holding up my 2 hands either side of my head once more. Only this time I want you to tell me which of my 2 hands are twitching. Okay, so we're going to use your right and your left. Okay, fantastic. Whew, sweaty gloves. It's good to get out of those, it's very hot. Okay, so looking again at my nose, and again keeping your head still, you know the score by now. Alright, so which set of 2 fingers are twitching? There we go, look at my nose. Good. Very good. I did my best there to try and deceive you, but yeah, the 3 in a row was a little bit cheeky, I must admit, but you did very well there, so once again, very well done to you. Okay, we've pretty much done every test available now. I just want to finish on the focus test. Okay, so using my light again very quickly. I want you to switch your focus between my nose, which will be close to you, and a point on the back wall. Now, as I will be getting your vision, try to pick a point around my head that you can sort of stare at. Okay, so rather simply keep your eyes on my nose, and then I want you to switch your focus. Your focal length will change once you concentrate on the back wall. I'll just be checking, make sure everything's okay with both eyes. Okay, so when I say the word switch, I want you to switch to the back wall and back to my nose, etc. Okay, ready? Okay. So starting with my nose, try not cover it up. Okay, now switch. Looking at the back wall, keep looking at a point behind me. Okay, and switch. Keep looking at my nose. Good. Switch. Okay. Switch. And and switch. Okay, everything's fine. Wonderful. Right, that brings the test to its conclusion now. We don't normally go through all the tests, but I just wanted to see how good your eyes were. Since you've been acing all the tests, I just thought it would be interesting to see if I could, you know, pick any holes in your vision, but clearly you are very good indeed across the board. So not only did you pass every test available, you aced every single one, so you should be pretty proud of yourself. So excellent going. Alright, so that's it for now. If you want to just check in with reception, and they'll deal with you. But for now, we'll say goodbye here. Thanks for stopping by. I'm sure the next eye exam will be just as successful. Alright, well, it's lovely to see you. Yep. And take care of yourself, and we'll probably be seeing each other very soon.